BPH is a condition that affects millions of men. As you get older, your prostate continues to enlarge, and the prostate's like a donut. The donut hole is where the urine travels through, and as the donut gets bigger, the donut hole gets smaller. We have treatments that we can do in the office without general anesthesia that don't cause any problems with ejaculatory function, erectile function, or urinary control. Medications that can help relax the donut hole, such as Flomax, or otherwise known as tamsulosin. We have finasteride, which is known as Proscar. There's another medicine called Avodart, and those can help shrink the entire donut, allowing patients to urinate better and perhaps push away surgery. Now, some patients even take daily Cialis, which can have some improvement on urinary symptoms. Now, medications can represent a cost for patients. You have to continue taking it for life, and medications can have side effects. Tamsulosin or Flomax can cause problems with ejaculation. Finasteride, there's another one called Avodart, and those medications also can cause problems with erectile dysfunction in a small percentage of patients, but it's something that you can see, and I have seen as a urologist. These therapies are known as Rezum, which is steam therapy for the prostate, which was just recently approved in late 2015, and Urolift, which has been around for a few more years, which also can help improve urinary symptoms. Urolift, again, is a procedure we do in the office, and we go in with a scope. We've numbed the prostate using some lidocaine. There's no IV involved, although we sometimes do offer patients sedation with Urolift. But again, it's done in the office, and through the scope we're able to deploy these sutures. They're surgical sutures really that function as anchors, and they pull the prostate apart, and this opens up the passageway. It opens up the donut hole and allows urine to flow better, and patient's symptoms are improved. Is Rezum, or steam therapy for the prostate. This is an exciting procedure too. Rezum involves the scope being entering into the urethra, and we deploy a few milliliters of steam, and the way the steam works is it goes into the prostate and the heat is deposited there, and the steam goes through all the different boundaries between the cells of the prostate, and it disrupts these cell walls, which then causes the cells to die and involute, creating an open space. It almost looks like what we would do if we did a classical TURP, where we cut away prostate tissue, which again is our gold standard. So it's very impressive what both of these therapies can do. With the Rezum, we typically will send you home with a catheter or teach you how to catheterize yourself for a few days. There's some swelling that can occur after the procedure, and for about 4 weeks the swelling can cause some increased frequency, perhaps some urgency, and waking up more at night. We'll keep you on your medications if that's what you were taking originally, and we'll give you some other medications to try to relieve these symptoms. But then after about 4 weeks, patients feel much better typically with their urinary symptoms. The therapy has durable results. The latest study so far has shown 1-year results, and I am confident, because of the way the prostate looks after the therapy is done, that data will show continued improvement in urinary symptoms over time. So, in summary, Rezum can be performed in the office with an ultrasound-guided nerve block. No IV is needed for the Rezum therapy. Patients are able to get off the table right after the procedure and go home. The procedure can treat any type of prostate, including median lobes or what we call ball valve prostates. However, large prostates may not be as good for Rezum. The sterile steam can cause initial swelling, and so we usually leave a catheter for a few days or teach you how to catheterize on your own for a few days for your own comfort. There can be symptoms such as urgency, slow flow, waking up at night, and burning, which can be worse than initially for a few weeks until the swelling goes down. Medications can help minimize these side effects. Some patients report they may see some blood at the beginning of their urination for the first couple weeks. But patients really notice significant improvement that's better than medication and almost really as good as surgery about 4 weeks, 5 weeks after the procedure. The Rezum procedure shrinks the prostate like surgery without any cutting, providing a much improved flow. Typically should not affect urinary control, ejaculation, or sexual function. The Urolift is another office procedure which we perform. We can do it with a prostate block. Sometimes we use IV sedation for patients. A catheter is kept in place, usually for an hour after the procedure, and patients can notice some blood in the urine or a worsening of their symptoms for a few days. In Urolift, the sutures that are used open up the prostate passageway without any cutting. Flow is improved. It's typically better than medication, but like Rezum, not quite as good as surgery. Urolift also should not affect urinary control, ejaculation, or sexual function. A lot of patients ask, well, which one is better? Unfortunately, we don't have any head-to-head studies yet. In my experience, I think Rezum can be used to treat a wider range of prostates. Both are very tolerable in the office. We haven't had to use IV therapy for anyone who wanted the Rezum procedure, and both are very simple to perform. Both should have good long-term effects based on their data.